This is my audience for my speech on diabetes. My name is Lillian. I want to talk to you a little bit about diabetes. Diabetes is a chronic metabolic disorder in which your body's insulin levels are abnormal. Can you pinch an inch or two on your midsection? Does this mean that you are at greater risk for diabetes? Yes, it does. Not all people that have diabetes are obese. Look at Halle Berry and Tom Hanks. Both of them have diabetes. You may have some of the signs and symptoms and never realize it. I will talk a little bit about different types of diabetes, the risk factors, some signs and symptoms, and treatments. There is 4 different types of diabetes according to Ferber, who wrote the book on diabetes. Type 1 is insulin dependent, onset at your early age. The body produces very little insulin, if any. These people must have insulin injections every day to survive. The insulin injections are usually given every meal. Type 2 diabetes is non-insulin dependent. The body does not produce enough insulin, or it does not use the insulin properly. Pre-diabetes, blood glucose levels are above normal, but not high enough to be considered for type 2 diabetes. This is reversible with proper diet and exercise, according to Briscoe, who wrote the book Diabetes Questions You Have and Answers You Need. Gestational diabetes occurs around the 24th week of pregnancy and lasts till the child is born. Usually the gestational diabetes will no longer be relevant to the mother's health once the child is born. There are several risk factors for diabetes. Family history, especially if your parents or grandparents have diabetes. Race increases your risk due to genetics passed down from previous generations, like African Americans, Hispanics, and Asian Americans are at greater risk according to Zimmerman and Walker, who wrote the American Diabetes Association Complete Guide. Age also is a risk factor for diabetes. The older you get, the less activity you will be able to do or want to do. The Everyday Meal Planner for the type 2 diabetes, written by Carl and Henry, states that the diet unbalanced to eating a lot of junk foods like cakes, candy, fast foods will cause weight gain and increase your risk for diabetes also. Exercise at least 30 minutes 3 times a week will lower risk factors. Don't just sit in front of the TV or a computer. Get active, explains Barnett, who wrote Obesity and Diabetes. Medical Surgical Nursing by Timby and Smith proposed damaged immune system can lead to the body's inability to produce or use glucose properly. You may have overlooked some of these signs, and you may have them and you not even realize they are signs of diabetes. Increased thirst. That means whenever you drink something, 5 minutes later you want something else to drink, or you just can't seem to get enough water. Increased urination. Going to the bathroom between 10 and 12 times a day is not a normal activity for a normal person. This could be a risk factor or a sign that you are at that stage. Extreme hunger. Even when you just ate, you still feel hungry, that you haven't had enough food or you still want more. Weight loss without trying to lose weight is also a sign of diabetes. Blurred vision, unable to focus on things clearly. When you look at an object and it looks kind of blurry, but then you look back a little later and it's clear. This could be also a sign of it. Fatigue, feeling tired, no energy, worn out. Your body always seems to hurt or ache. You have a slow healing sore on your leg or arm that just doesn't seem to go away. This can be a sign of diabetes. Diaphoretic or sweating with no physical activity or increased heat. If you're in a store and all of a sudden you start feeling weak and funny and you start sweating and you feel like you're going to pass out, that's a sign of low blood sugar. You need to eat something sweet. Let's move on to some of the treatments. Daily blood sugar checks done before meals, or if you think your blood sugar levels are high throughout the day, check your blood sugar. It's just a little prick on your finger. Diet change to decrease starchy foods and foods high in carbohydrates. Replace those foods with foods high in protein. Skip the potato chips and stuff. Eat some blueberries, some oranges, apples. Any type of green leafy vegetable will help. Type 1 diabetes can have a pancreas transplant. This will allow the person to no longer be dependent on insulin injections. Diabetes is a chronic metabolic disorder in which the body's insulin levels are abnormal. Please get tested if you have several of these signs or symptoms of diabetes. Early intervention is the key. Thank you for listening to my presentation on diabetes. Have a good day.